Thank you for joining us this evening. This is our next talk with Anglo doctors in Israel. Um, we're so happy that they are joining us today and that you're all joining us to hear from them. For those of you that don't know, SJMA is a student branch of the Jewish Medical Association, which supports doctors and healthcare workers in the UK, running social and educational events. I'm proud today to welcome Dr. Rivka Lebrett. Rivka trained in Manchester and started her foundation years there before making Aliyah midway through her F2 year. She's now completing her GP training in Israel. She's also the founder of Anglo Doctors in Israel as an organisation and is here today to tell us a little bit more about that, share her wealth of knowledge of what it's like to make Aliyah as a British trained doctor at different points in your career. She's also joined by Michal, who will be sharing her expertise in internal medicine training in Israel, also as a British medical graduate. Thank you so much both for joining us. I will hand it over to you.
Thank you, Rebecca. I wouldn't say a wealth of knowledge, but very excited to be here. And I think I recognize a few names. So hi. Um, as Rebecca said, made Aliyah between F1 and halfway through F2 actually. And yeah, we really hope this talk is helpful. I understand that you've got your foundation year placements just this week, and some of you are thinking about it. So we hope this talk is going to give you, firstly, a really good overview of Israeli healthcare, what the training is like here from medical school, foundation years, which is called stage here, and then specialty training, which is called hitmachut or residency. And then we're going to talk about the different points that you can make Aliyah, so either at this point, between medical school and stage, or foundation year, or after foundation year, or after you've finished your specialty training, and just discuss the processes and the pros and cons, and share our experiences as well as we go along. So I'm going to hand over to Michal to start.
Okay, hi everyone. Can you hear me? I hope you can all hear me. Just to introduce myself, my name is Dr. Michal Julius. I am very excited to be here because I was also part of the student JMA in my time, and I'm glad to see that it's still going strong 10 years later. Just a quick background about my story. I started medical school in King's College in London, and I made Aliyah in a bit of an unconventional way. In the middle of medical school, I made Aliyah. I finished my studies in Bar Ilan in Sfat. I did stage 1 year in Kaplan Medical Hospital in medical center in Rehovot. I then did 4 years of residency in internal medicine, and I'm now doing a subspecialty in endocrinology. So if any of you have any questions along the way, then I'm happy to answer, or we can save them for the end. So just to tell you a bit about how the healthcare system in Israel works. The healthcare system, unlike the NHS, is divided into 4 separate organizations, each of which is required by law to provide the basic care to any patient who's enrolled in their healthcare system. And every Israeli person, everyone who's got residence in Israel, has to be a member of one of the 4 healthcare systems. So these systems are called Kupat Cholim, and there's 4 of them. The 4 of them are Clalit, Maccabi, Leumit, and Mechedet. And each Kupat Cholim is required to give a certain basic level of care to every single patient who is registered within them. And then on top of that, patients can pay a little bit extra for additional care, which is not included in the basic coverage. So just a little bit about the information of medical schools in Israel. There's been big changes in the last few years. Until recently, there were only 5 medical schools in Israel, and those were in Tel Aviv, in Haifa, Jerusalem, Beersheba, and in Tzfat. And recently, because of the need in Israel for more doctors, they've been opening new medical schools connected to different universities, one of them in Ariel, one of them Herzliya, and they're currently in the process of opening 2 more, one in Haifa and one in Rehovot. So the medical training in Israel is quite similar to the medical training in England, in the fact that there's no pre-med requirements like there would be, let's say, in the United States. It's usually a 6-year program, and after the 6 years, you're required to do 1 year of stage in order to fully qualify and receive your license. However, there are some other options, which is a 4-year program, which is for people who have already acquired a BSc. Then they can go on a faster track program where it's obviously more intensive. They don't really get any holidays, but they do get the same training. And then there's the 3-year program, which is a very small program, and that's intended for Israelis who started their medical school and their preclinical years abroad, and then come back to Israel to finish their clinical years. And the clinical years are every medical student that finishes medical school in Israel is required to finish and do the national exams. And there are 5 national exams that every Israeli medical student is required to do in different specialities, including internal medicine, pediatrics, surgery, OBGYN, and psychiatry. However, there are exceptions, for people who are coming from abroad, so they're not required to do that exam, and it's usually encompassed all in one exam. Okay, so we can move on from the medical school. So now I'm going to talk a little bit about stage year. So the stage year is relevant to anyone who's finished medical school but has not got their license yet. And it used to be a 1-year program, but they've recently reduced it down to 9 months. And the 9 months are all based in the same hospital. They include 3 months of internal medicine, 1 month of emergency medicine, 1 month of pediatrics, 1 month of surgery, 1 month which is called selective, which you're basically allowed to choose in the hospital that you're based in, in a core speciality, and 2 months of elective, where you can choose anywhere, not the hospital that you're connected to, that you feel that you would want to go and check out that department. So stage is allocated based on some sort of lottery. So every medical student who is finishing medical school in Israel will be entered into the lottery, and they can put their preferences of all of the hospitals in Israel. There's 26 hospitals in Israel, so they put their preferences 1 to number 26, and they are chosen based on to increase the chances of making the most people happy with the choice, which means that the majority of people will get their first 4 or 5 choices, and then there will be a few who get the choices which were at the bottom of the list. In terms of the placement, there's also a separate placement for people who are coming from abroad, and that's in a completely different lottery. And how stage works is that it's expected for the newly qualified medical students, or almost doctors, to be every day in the hospital, and then around once a week they have a 24-hour shift. So it sounds very crazy. This is the part that's different from the medical system in England. 24-hour shift would start at 8 a.m. in the morning, and it would finish at 8 a.m. the next morning. And during that time, it's required also to give the resident or the stagiaire at least 2 hours of sleep. These shifts are additional pay on top of the basic salary that a stagiaire would be earning. And stage is a year that's required in order to get the license, but it's also a year that's really important, because if you are interested in doing residency in Israel, stage is the year where you're going to find out which departments are relevant to you, which departments you enjoy being in, and if there's the balance of not as much responsibility, but a lot of exposure, which is exactly what you need if you're looking to go into residency in Israel. So I'm going to talk a little bit about residency. Residency is a specialty training that is required in order to become a Rofa or Rofe Mumche, which is like a is a consultant at a consultant level. And the training usually spans between either 4 to 6, almost, or 6.5 years. And throughout that training, there is the doctor is inside the department almost all of their training period, and there are certain periods of rotations where they'll be doing other training alongside that. So the requirements of hitmachut, which is residency, is a certain amount of time depending on which residency you're doing. So I'll give an example of myself. I finished internal medicine, and the internal medicine is 4 years. And each residency can also require you have a certain workbook that you need to get signed off, that you've done the procedures that are needed. Within the residency, on top of that, there's also a part of the residency that's called Madei Hayasod, where it's some sort of research project that you're given time and you're getting paid for to do during the residency. It's usually about 6 months. And on top of the required time in order to finish the residency, there's Shlav Aleph and Shlav Bet. Shlav Aleph is a American-style multiple choice questionnaire, which every resident needs to pass after they've been 2 years within residency. And after you've passed Shlav Aleph, you can go on to do Shlav Bet. And Shlav Bet is an oral exam in front of 3 senior doctors of that field, and where they would usually present a complicated case, and the doctor is required to understand and follow through with the requirements of the case. In terms of residency, the residency is recognized by the Scientific Council of the Israeli Medical Association, and currently there's 58 specialty fields and 32 subspecialties. So there's some specialities which you can only go into once you have a subspecialty. So for example, in my case, I did a subspecialty of internal medicine, and now I'm doing it's called a tat hitmachut, which is a second training in endocrinology. So just a bit more about how do you get into this hitmachut. So stages are really, as we said before, that's a really important time, because that's the time when you're going to be looking at the departments. The departments are going to be looking at the students and at the doctors who are coming in. And through that experience and that exposure, the doctor will decide which department, and the department will also decide if the doctor is fitting for the department. So people usually set electives in departments that they're really interested in doing their specialty training in. And through the exposure of the departments, that's how the placement is placed. It's not as it is in the UK, where you'd get allocated. It's more about individual work, finding connections and finding the department that fits best for the place. And there's a concept in Hebrew called the teken, which is basically a position where the department will be paying for that specific doctor to be filling that teken for the time length of the residency. So if it's 4 years or if it's 6 years. Okay, so each department will have different numbers of required toraniyot. Toraniyot is the long shift, which I was talking about. So some will have, let's say, 5 a month, and some will have more than that. And the hospital requires that during the hitmachut, the resident is also doing between 4 and 7 toraniyot a month, and those will also include some weekends. Is there anything else I wanted to say? I think so. The main way to understand the process and to understand the department is really to see it and to be in it, and that's how the application and acceptance procedure is formed. And Shlav Aleph is contingent. Shlav Bet is contingent on passing Shlav Aleph.
Real. Does anyone have any questions like up until now for Michal?
You can also write them in the chat and maybe some.
You can also put on your cameras as well so we can say hi.
I don't see any in
You
the
might
chat.
come to this.
Oh.
So I might be asking prematurely, but I wanted to ask about the level of Hebrew spoken / written that you need. But I'm assuming you're going to come to that later, maybe.
Yeah. Okay, yeah, we are going to come to that. So I'll just keep going and we can do questions at the end, but like you're
Okay.
welcome
Sorry,
to chip in.
I had a quick question based off the application process.
Yeah.
That was all right.
Yes,
So,
Jack.
so what if you have your shtaz in a hospital, I don't know, somewhere in northern Israel, but actually you want to work at a completely different hospital? Does it mean that where you do your shtaz is kind of where you're going to do your residency as well?
That's a really good question. That's why within this, if you want to go back to the stage page, within the stage, there's built-in 2 months of electives where basically you can choose any hospital in the country and do an elective in whatever department you're interested in doing a residency in. And through that, they'll get the impression of you and you can get the impression of the department. However, it is, I have to say that it is limited because you only have 2 months and each month has to be in one place. So you really only get 2 choices if you're not in a hospital that you'd like to do your residency in.
Okay, so I'm going to carry on talking a bit about family medicine training, which is what I did. So, how it works, basically, I don't know if you've gathered so far, but in Israel, it's very different from England in terms of like how standardized it is. It's all about like connections and like figuring out, like you figure it all out by yourself, basically. Like, so, with family medicine, each kuppah train you can apply to each kuppah. So we spoke before about the 4 kuppot, which are instead of like 1 NHS, you have 4 kuppot, which is the equivalent, who are providing the healthcare, as Michal said. And they are responsible for training up like the family doctors. So you apply, you interview. There's no like set date where you have to apply by. There's no portal. It's literally like you try and find someone who works within the kuppah that you're interested in. For me, it was Klali. I found someone I knew, and he helped me find like the email of the secretary. They call you in for an interview. There's a few different stages. And then you get accepted. Hopefully, if not, you then try it with a different kuppah until someone lets you in. And like as a side, I first applied to a different one, Mu'khada, and they didn't accept me because my Hebrew wasn't very good at all. In fact, I did my interview in English, which was like just future tips, don't do that. So the program is 4 years, and like not I won't go into so many details, but like you basically the first year and the last year in the clinics, like in the GP clinics, and then the middle 2 years you're doing hospital rotations. I wanted to mention like a bit about pay because like I think that's often a question that comes up. So first of all, you're working 42 hours a week. One of the reasons I picked family medicine is because I'm not as brave as Michal, who did 4 years of on-call shifts, which are 26. She says 24, but it's usually 26, right? Because you have the morning, you have to then do the morning handover as well. So they often don't leave until, much later on. And like I just couldn't see myself doing that after like 12-hour shifts in England. So with family medicine, most of the time you're not on shifts, but you do have like a 9-month like internal medicine placement where you are like part of the on-call rota. I was going to say about play, but I can't remember how I got to that. Anyway, so it's 42 hours, and like ballpark figure, like between 13,000 shekel a month is what I'm earning like as a resident. I'm still in the middle of my residency, so I'm in the 3rd year of the 4 years. And like Michal said, there's a Shlav Aleph exam and a Shlav Bet exam, which is basically part 1 and part 2 that you have to do in order to pass. So what we want to do now is like we've given you like basically an overview of the training, etc. And we want to just talk about like the different points that you can make Aliyah at and how it works, which I feel like, so I mean I don't know if any of you want to like say anything, but like you guys are here because you're considering making Aliyah like now before F1, or you're debating like doing it after foundation years, or like what's your
I think
If
it's
anyone...
a mix. So some people are final years, some people, just because I recognize their names, I know are second, third, fourth year. So some will be thinking about next August and not wanting to go wherever they've been sent. And some will be thinking about planning ahead for if they try to send them to somewhere they don't want to go. And I think we also have a couple of doctors on as well who don't know where they are in their careers, but might also be thinking about Aliyah, probably, I'm assuming, earlier on, like early year residents.
Okay. Okay, cool. So we're going to cover like at each stage. Generally, the earlier you come to Israel with like the least responsibility, like the more time you have to like learn the language, get to know the system. So like generally the earlier the better. But I'll just explain. So if you decide after medical school that you want to move, you've already got like your degree. So you have to do the Israeli medical license exam, which you can do in English. It's twice a year. In order to sit the exam, you already have to be an Israeli citizen. So the first step for anyone is to start making Aliyah. The Aliyah process with like by contacting a Jewish agency person. And there's Manchester, London, I whoever they are, I don't know their names or numbers, but and you start the process, you get your license, you fly to Israel, and then you can apply to sit the Israeli medical license exam, which is, yeah, like I said, in English, it's a long exam. Apparently it's about 6 hours. If you pass, that's great. If you fail, you get your money back and you can sit it again, or you can appeal. And that's all done through the Ministry of Health. There's like an online portal that you can apply for. So those are just the stages, and then like as Michal spoke, like you talked through, you enter once you've passed that exam, and you also have to do a BLS, like a basic life support course, and you have to pass some sort of a first aid training. Then you can enter like the stage lottery. Then they decide like fine, you're on the same level as everyone else entering stage, and like you can like enter the system at that point.
I will just add that the stage lottery, there's two separate lotteries. There's one for Israelis who have graduated, and there's another one for people who have made Aliyah and are coming from abroad. And the lottery for people who have made Aliyah coming from abroad is a lot more favorable, as in people are much more likely to get exactly what they wanted in the lottery. Yeah.
Yeah, good point. So like you have that in your favor, which is really good. And then you have to be ready for stage in Israel. It's like a hard year. Like Michal said, you're doing a shift once a week and you're learning the system and you're learning the language, but like you do have the benefit of like not having too much responsibility and having like more support. So it's like yeah, I've not done it, but it's okay. And if you want to be in touch with like people who've made Aliyah at that stage, you can also like we can give out numbers and like make contacts. So the next stage is like after foundation years and before you've started your specialty training, which is what I did. So Israel only needs 1 year of like the internship, so you don't need to do like the full F1 and F2. You can just come after F1, and at that point all you have to do is paperwork. So you've already got your license with the GMC, and you just have to have it converted. It's like a load of like paperwork. You get a lawyer to do it, and actually the Israeli government give you all the money back as well, which is really great. So it takes a couple of months. Like you can only once you have your Israeli license, so you need your actual like Israeli ID number, then you can get your medical license. And then you kind of have to, first of all, you have to know what residency you want to do, and then you have to like basically figure out on your own, which was what my experience was. And one of the reasons like we started Anglo Doctors in Israel is to like try and give you more support in like finding those contacts and like getting into the programs. I've put here a link of a blog which I wrote, basically looking at the different residencies in Israel and how they work. So like I think a big question for you at this point will be, like, let's say you know for sure you want to do obstetrics and gynecology or psychiatry, is basically like comparing what the residency program looks like in England versus the program in Israel. Like if you're everyone has different timelines of how quickly they want to get to Israel, but in Israel you can't do residency hitmachut like part-time. Everyone has to do it full-time. There's no exceptions. You've got the difficult on shifts. So it's just about really understanding like if it's going to be longer or shorter and like weighing all that up. So all that information, like I went over a few of the main like most popular programs there, but there's also a link that you can find the curriculums of each training. And I put these logos here because I quickly wanted to say, so the Ministry of Health is the governmental body that is in charge of like giving people medical licenses. And then the Israeli Medical Association is like it's like basically the union of all doctors in Israel, and it's a bit complex here, but they are in charge of all the specialty training. So it's two separate parties. They decide the curriculum, like they've like decided like the family medicine curriculum that you need to do 12 months here and 9 months here and 6 months here and pass the two exams, and then each Kupa, each healthcare like has to make sure that they're meeting that. So this will link you to the IMA's website with all the different curriculums for all the different residencies. So I recommend looking at that if you already know like what you're interested in. And then the third option is making Aliyah like after you've already done your specialty training. Like very recently, they changed it. So in the past, you would have to do like a period called histaglut, which was like, how do you translate that? Getting used to it.
Observation.
Observation. That's histaglut. And anyway, a period of you would just be like shadowing without pay, I think, as well, before they would like then give you your specialty license. But there's been like a real push to like bring more doctors to Israel for a number of reasons. So they're trying to make it much easier. And one of the things they've done is this like it's called the green path or the fast track. And basically anyone on these from any of these countries, so United Kingdom, happy days, if your residency program is basically similar to Israel's residency program, or at least 70%. So let's say GPing is 3 years in England still. So that would be fine because it's like 75% of the program in Israel, which is 4 years. And like they want to see basically that like you've had enough like similar amounts of experience in whatever, into general medicine, psychiatry, geriatrics, whatever, that you're going to be on the same level as the other GPs in Israel. So that basically, yeah, that's the way up at that point. I'm thinking if there's anything else to add. I will just say like just like from my experience of like seeing doctors who've made Aliyah at this stage, like it's hard because you come to Israel and you're a fully qualified consultant, specialist, whatever you are, and they now that they've done the fast track, which is great because you can start working and start earning money straight away. But that means that you suddenly have patience and responsibility, and you still, you don't know how to say cough in Hebrew or like use the Hebrew notes like software or whatever. So it can be like really, really, yeah, it can be really hard at that point. So that's also something to bear in mind.
I will also add that it's very individual. It's even though there is a fast track, the IMA, which is the Israeli Medical Association, can decide based off every single individual where they did their specialty training, how much extra histaclut they want them to be doing. Just as a quick story, there's a very, very senior cardiologist who performs catheterizations all over the world, and he's a lecturer, and he made Aliyah recently, and he had to be under histaclut under people who he was lecturing for a few months before he got his official license and was cleared to be a consultant. So it's very per case basis. Yeah.
Good point. Yeah, it is very per case. They have like a whole panel who will sit down and they'll look at everything you've done and compare it and decide So yeah, that's a good point. I'm trying to think if there's anything else. Any
Can I
questions?
ask a quick question?
Yeah.
So I was under the impression, and I don't know where I heard it, that if you'd completed 50% of your specialty training here, then it would be recognized by Israel and you could finish off your specialty training there. I don't know if you know anything about that.
So I don't know specifically that one. I know someone recently who basically he came after F2. And he'd done he's started pediatrics here, and he also came thinking that he could then use he did also like locuming in F3, and he had like a lot of experience, and he thought he would then be able to use that to cut down on his training in Israel, because he'd heard like what you said, something similar, and they wouldn't let him, and he
Okay.
like really fought for it, and they said like it's not a thing anymore,
Okay.
because I also had heard of someone previously who did manage to who like spent a couple of months in F whatever, and they got it cut out of their specialty
So
training. But
don't rely on you can start GP training here, get a year and a half the way through, make Aliyah, and not have to start again.
yeah, don't rely on it at all. He like really he like went in thinking that was the case, and he was sure of it, and he spoke to a lot of people and like did a lot of work, and he wasn't able to get any of his time taken off.
Okay.
Which is really frustrating, but also medicine here is different,
Yeah.
and it's really helpful to like do the full training here.
I mean, I've said it before, medical schools in the UK teach you to practice NHS medicine, which is different.
Yeah, yeah, it's different. It's a whole other world here, which we can like talk a bit about. But I mean, it's medicine is medicine, yeah.
Yeah.
It's antibiotics and it's creams and it's etc. But definitely a different gisha, a different approach.
Yeah. Okay, perfect. So we can get the word out that don't rely on this 50%
Don't rely on
halfway
it.
through your training.
I could, yeah. I could try and find like official wording. I mean, it was I won't say his name, but
Yeah.
yeah, it's
Okay.
sort of
Yeah.
Hebrew, um, which someone asked before. I forgot the exact question, but Hebrew is a big deal. Like the earlier you can start learning it, the better. It's like communicating with other doctors, communicating with patients, writing in notes. There's a lot of like, oh, I don't remember what it was like, but there's a lot of everywhere. The case presenting in front of everyone here. My experience in Israel, it's like the handovers are like full meetings, and it's in front of a lot of people, and yeah, doing it in a second language is hard. So, having said that, like everyone here learns medicine in English. All the guidelines, all the American guidelines, the European guidelines, the textbooks, they're in English. So everyone does speak like a the doctors speak a basic level of English, so you can communicate with people. They will understand like if you've written notes in English, but you have to learn Hebrew. I just wanted to give some advice about like listening to like start now, like whatever like stage you're going to make Aliyah, if it's 2, 3, 4 years, like start early. Listening to podcasts, there's loads of medical podcasts in Hebrew you can listen to. Put Hebrew subtitles on like any Netflix or whatever that you enjoy, or find Hebrew programs. All pan is good, but like the main thing is like talking. Also using AI is like really, really great. Like you can talk to like ChatGPT or Claude or whoever's your AI favorite, and like they can correct you and like do things like that. Michal, I don't know if you have anything to say on Hebrew, but
I think you've said pretty much everything. I'll just give a word of an encouragement that there's not an actual formal exam that you have to pass. So it's just about the
no.
proficiency and being able to talk to patients and express yourself in the way that you should, but there's not an exam that you need to do in order to get your license or do whatever.
That's
Well,
actually
but
changing. Sorry, I'm
yeah, it's
interrupting.
changing.
Just because I'm, yeah, like going through that now, and if you apply until the end of 2026, it's fine. But then from next year, you do have to take an exam.
Okay, thanks for the
So
update.
thanks for the update. No, they were talking about it in the Ministry of Health that they want to start, but like I hadn't heard that it was already from 2027. So yeah, you'll need to pass that exam. Good luck. Start early. Um, I can like recount like mortifying stories of patients coming in with things, and I had no idea what they were saying until, yeah. Anyway, the more Hebrew you know, the better.
In my
Um,
Shlav bet, I didn't know the Hebrew word for an elbow, so I just said elbow.
um, cool. And then yeah, I wanted to just end with a bit of positivity about why practicing in Israel is great. Like we there's the practicalities and the weighing up and the Hebrew and the residency and comparing. And like it is like, yeah, it's a lot less cushy. Oh wait, before I do the positive, I'm saying the negative first. You have to be realistic about what you're getting yourself into. Like, I've spoken to a few doctors recently who like started in the hospitals and were really like, a few of them quit even because they just weren't like expecting what like they were coming into. The shifts are hard. Communication is different here. So like if you want to call in like a senior doctor, Michal will know better, but like my experience as an F1 in England is like if I phoned up a consultant, they were always kind, they were always understanding. If I'd woken them up in the middle of the night, I called a urologist in like with nothing, and he like was so nice about it. And in Israel, like it's less nice. Like they can like be upset with you. They're shouting. There's people like the communication is just very different. I don't know if that would you agree with that, Michal?
I would say it's very much department based.
The part, okay.
It's very difficult to generalize. It's dependent on the individual and the department, kind of the vibes of each department.
Okay.
Yeah.
That's a nice way of saying it. But the communication is like much more direct here, generally. And there's yeah, a bit more high stress, and especially when you're trying to learn the whole system and learn the language, it can be tough. So just like be aware. But why we do love practicing in Israel. So for me, I like the biggest part of Aliyah was that like being able to like just be 100% myself in work. Like I wasn't hiding anything. I wasn't embarrassed of anything. Like I was the same person in work and out of work, like in every aspect of my life. Like I didn't in England when I was doing my F1, like I didn't have that experience at all. Like I felt like I was definitely like concealing parts of me at work and like I wouldn't bring up certain things. I actually had a very fun experience on day one of F1 of like blatant anti-Semitism in like the doctor's room where they were like discussing about Jews running the world and like just how much money Jews have and like the worst thing in the world that they could imagine is being Jewish. And like I was sitting there. So here it's like the food everywhere is kosher, which like is important for me, and like just everyone understands. I don't have to explain myself ever. Like it's just great. It feels like everyone's family here, like patients and doctors, like there's just like much less formality, which I love. Like everyone's just like very warm and like there's no pretenses, like for good and for bad. Generally things are just less formal here. Like you don't have to wear smart clothes every day. Like everyone's in jeans on the wards. Like the consultants, like I binned all of my work clothes. I binned them way too quick. Like I need actually a few more. But doctors are in sandals. Like it's literally like a different world. Nail varnish, hair down. It's like yeah. And do you want to add anything about what you love, Michal?
Well, I never actually practiced in England, so I've only known practicing medicine in Israel. But I do feel like it is an honor to be able to practice medicine in Israel. I was thinking about it on Yom HaShoah, where there's a siren and everyone is quiet, and you're in the middle of a bustling, busy ward, and everyone takes that minute to just think about the privilege that it is to be living and practicing and working as a doctor. Well, for me at least, in Israel. And obviously, it comes with the difficulties that are part of being in Israel, but it's a privilege to be here, I would say.
Yeah, 100%. It's like very, very special. Um, So that's that. I wanted to add that anyone who is interested, on the 10th of May, there's going to be like a Nefesh B'Nefesh fair in London. So IMAP, I don't know if you've heard of IMAP or MedX. You've heard, so that's run by, it's like a joint office between Nefesh B'Nefesh and the government office, like the Ministry of Aliyah and Integration. And like their whole thing is to like bring as many doctors to Israel as possible. And Ronen is in charge. Ronen Fuchsman is the Menaher, like the manager of the office from the Nefesh B'Nefesh side, and Alison is like the vice. Anyway, both of them are going to be at the fair. So like, if Aliyah is definitely on the cards in the near future, like go and get to know them. Like they're really important people to meet, and they're also really, really helpful. And then also there's going to be a MedX in October 25th, which is like the best thing that ever happened in the world. They like, you literally can show up with all of your documents, everything you need to like get your license in Israel. So this is only applicable for everyone who's done foundation years and they've already got their license. And they basically will convert everything for you and sort you out. So that's really yeah, good to know about. And then just the Jewish Agency does Aliyah from England, so that's that. Any questions?
Another quick question. I was told that Misad Klita have now stopped giving Tekin Ole, so like they're not giving any more financial support to hospitals to hire Olim doctors for cheaper. I'm guessing they just don't have enough money. But you might not know, but like, do you think that will affect Olim doctors who apply for residency? Like, will it make them less desirable compared to Israeli graduates?
Has that been confirmed? Because I was told by MedX, I think 6 months ago,
It's
that
something.
it was there.
It's something I was told informally that
Okay.
it's like going to happen.
I don't know about Tekken or not, and but I can just say like from my experience, like the general approach that like the medical training in England is like very well respected. And like they were really excited to like I didn't get a Tekken Ole, like I got a normal Tekken. If your Hebrew is good enough, like they were so impressed with my Manchester University degree. Like I didn't tell them about PBL and how very little I actually learned, but an American, like yeah, they for some reason think like Western training is very, very impressive. So I think we're considered like very good candidates, and as long as you can get through an interview in Hebrew, then like you have as much chance as anyone else. Like I will say, like Michal said like already about the 2 months elective that you get in stage, like those are really like that's a really, really important opportunity to like impress, like make an impression on like specifically in like hospital departments. But I mean you can also do those electives like in a GP clinic as well. So technically, like if you're coming after stage, like it can be harder to like wedge yourself in there and meet the right people and make those impressions. So like if you know you're definitely coming, like it might be worth considering like that should be part of your way up. Like if you're already here, for stage, it gives you like that 7 months, because it as like Michal said, it's gone from 12 to 9 months. So it gives you that time to learn Hebrew, get familiar with the system, and then to find the department and make that impression in those 2 months to give yourself like the best chance of getting the Tekken. Like if you're, you know, like you're not going to get the boost from the Ole Tekken. So like it should be part of like the.
I'll add that I think that the Ole Tekken would never cover the full residency. Even in the past, the Ole Tekken would maybe cover 1 year or maybe 2 years of the residency, and the rest would be provided by the hospital. So it was an incentive to take Olim with the Ole Tekken, but it wasn't like they weren't dependent on that on the Tekken from as an Ole.
Makes sense.
I've got another
Thank you.
question. Sorry, hello, can you hear me, guys?
Yeah. Maybe if
sorry.
just like you talk and then next everyone puts their hands up and I'll go through
Oh,
it.
sorry.
No, it's okay.
I just wanted to know if doing our elective, like as in like while I'm in med school, doing my elective in Israel, if that's the same kind of thing as like doing your stage there, like making an impression on someone. So would you want to go somewhere where you'd want to do that specialty in that hospital, or does that not really count?
I will answer this question. I think it's a really good idea to do an elective in Israel in a department that you're interested in doing a specialty in. However, you need to have some sort of timeline in your head that you can present after your elective to the head of the department. So let's say you know that within 6 months you'll be making Aliyah, that would be a good kind of time frame. However, if you're planning on making Aliyah, let's say 3 years later, that's not necessarily relevant because they have to decide on the takanim within about a 6 month to a year period.
Okay, fine, thank you.
Dalia.
Hi, thanks so much. It was really useful. I just have two questions. The first one is how important is research? Because here they make a big deal, at least in my uni, like about getting papers, publications. Is that relevant at all to getting like jobs at any stage? Um, and then I just forgot the second question, but I'll remember in a sec.
Yeah, I remember also like trying so hard to get like onto papers before, like in the period before between making Aliyah and like finishing foundation, like, and for me they were completely useless. That's all I have to say. No one cared, but Michal might have something maybe in hospitals that's different.
I think it's very dependent on where you're trying to do your residency. If you're trying to go for one of the big hospitals, which are really, really high demand, and you're very focused on, let's say there's like 3 or 4 really big hospitals, then it is pretty competitive. And the Israelis are also trying to do research to prove that they are worthy candidates. However, if you're less interested in getting one of the very big main hospitals, then I wouldn't say that it's necessary. There's also it's also dependent on the residency itself. So there are certain residencies which are really, really high demand and super, super competitive to get into. For example, plastic surgery is one of the really high demand ones. Dermatology, really, really high demand. So with those specific specialities, you're competing against basically the best Israelis. So if you're interested in going into one of those high demand fields, then any research that you can do is helpful.
Okay, cool. And then the other thing is just like from what you're saying, it sounds like stage is very relevant, but F1 is the equivalent. Is it a thing for people to do F1 here and then do stage when they move, or like it's not really, you can't do that. You have to do one or the other.
It's remind me that I want to add something to the previous question, but there's no, you don't do stage. If you've done F1, you've got your medical license, and there's no need, and like you don't want to put yourself through it. Like there's what are you thinking? Like you'd benefit from it somehow?
Just by like kind of using it as a year of adjustment, integration, like all the pros that you were describing, but then at the same time, like I don't know if you come back to the UK, at least you're qualified in the UK.
Yeah, just because from the point of like the English point of view, that you have to remember that if you make Aliyah and you have not completed your F1, you do not have a GMC license and you cannot practice if you ever came back to the UK for any reason. And like even if you're coming back as a consultant, the GMC is making it harder and harder to use your overseas international specialty qualifications to then come and practice in the UK. And I know quite a few people that like went to Australia that have then tried to come back, and it's been a lot more difficult than it used to be.
Interesting. I think like yeah, in summary, I don't think there's any like they won't put you in stage.
So how can
Yeah.
you get the networking and get those, like how are you going to be able to get a job? Because it doesn't sound
So
like easy.
either do stage here or we have Anglo doctors in Israel, which is really like this big network that like I started a few years ago. I mean, it started as just a basic WhatsApp group, but it's like a really big network where like we have like very senior doctors who've made Aliyah who are like happy to try and help. I just want to say one thing about when you asked about research and Michal said like about the trying to get into like the harder specialties and the more competitive hospitals. Like I think part of for me, and like it's just advice, is that like you have to be easy on yourself. Like when you choose to make Aliyah, like there are some things that you're going to be like sacrificing. Like if I was in England, like I might have gone like neurology, endocrinology, like I was really interested in those. But like I realized like Aliyah because it's important to me to live in Israel for many, many reasons. And like part of that is I'm going to be picking now the specialty that's going to like be easier for me. And then also within that, like there's the Kupat, like there's Maccabi, which is much harder to get into. It's like for some reason it's like the better doctors get in, and like the actual like application and interview process is like really tough. And like I just said straight away, like I'm not gonna put myself through that. Like I know I'm like I don't need the stress. Like I'm gonna go with whoever like takes me, and like just be kind on myself. Like it's enough like being in a new country, learning a new language, learning a new system, not knowing like which shops to buy like basic ingredients, not knowing like what laundry powder is called. Like I don't need to like compete with like the best of the Israeli like physicians, because like if like being the best doctor is like incredibly important to you and you're not willing to like you just have to like you have to be able to like um what's the word, yeah, like be able to like understand that something's gonna have to like give, like either it's your mental health or it's like not making Aliyah, or it's gonna be like the career that like having said that, like you can like you start slow and you build yourself up. Like we have like in our community like doctors who've like gone really really far, and like they're really like department heads, and like they've done really really well. But I think it's just like being kind to yourself at the beginning, like arriving here after F1 and then trying to get into like the hardest specialty in the hardest hospital. Like, I don't know, just like take it easy and look after yourself.
I just want to answer Dalia's second question. It was about, remind me. I just had something that just
About like doing stage and F1
Sorry.
and like
right.
how to
So
get
you're
a job
saying, how
without
do you get a
stage.
job if you don't do stage here? How does someone do that? So if you're interested in going into hospital medicine, there's a period called histaklut, which is 2 weeks, where you basically turn up at the department head and you say, "Hi, I've just made Aliyah. I finished my F1 there. I've got my license. I'm interested in doing my hitmachut in this department. I'd like to do histaklut for 2 weeks," which is basically your shadowing. You're going to be in the department present. They get to know you, you get to know them. 2 weeks, you won't do any, get you won't get paid, and you won't be able to do actual clinical work, but you will be with the doctors and seeing how the departments run on a day-to-day basis for a 2 week period.
Thanks so much. The whole evening's been very useful. Thank you.
Are there any more questions? Dahlia? No? Still
Oh,
waiting.
sorry. Yeah, I had one question about family medicine. Is it true that family medicine in Israel is quite like research orientated compared to the UK, and like that they encourage you to like get involved in research? So I heard that in Israel it's quite like an academic specialty compared to the UK.
Like I've noticed so far, it might be in different cohort, it's different. Like in other specialties, they have like Michal did like mention the Madei HaYesod, like it's the period where they do research. I can't remember how many months you get.
6.
6 months they get to like sit and study and like publish a paper. We don't have that in family medicine. We did like at one point have like a few weeks summer program where we did like a bit of research, but it didn't actually go anywhere. I wouldn't like I like from my like personal experience, like with Clali, I wouldn't call it like an incredibly academic specialty. Like obviously you have the exams and you're expected to know like all the guidelines and all the latest studies and like be practicing the like evidence base, but there's no pressure to publish. I mean, there's like it's encouraged and like yeah, it's definitely encouraged, but I wouldn't like from my experience, I wouldn't call it like heavily research based.
Okay, not sure where I heard that though, but thank you.
Pleasure.
Are there any more questions? Yes, Lara.
Hi, thank you so much. This is really helpful. I was just wondering, if you train in family medicine in like Clalit, you said, can you then move to another Kupa?
Yeah. Good question. So once they've like paid for your training, you are expected to stay with them for at least like 1.5 years to 2 years. I can't remember the exact number. And then you can switch. You can do whatever works for you. Like a lot of like the training, it's like very helpful to train in the kupa that you're then going to stay with, because a lot of it is like learning who you're referring to and like the specific like details of that like healthcare system. But you're not tied to them. You can go anywhere. And once you finish the year and a half after your training.
Okay, thank you.
I have one more question. I suppose it's not so much about practicing, but more about being the patient. When you make Aliyah, can you pick your kupot, or are you assigned a kupot randomly?
Michal.
You come to the airport and you're taken to a government office within the airport, and the first decision you have to make as an Israeli is which kupa you're going to be joining.
Right. Lovely. Golda?
Hi, I have a question. I don't know if you guys will be able to really help, but I'm Israeli, and I was wondering if you know of people or have personal experiences of Israelis that are coming back, not like proper Israelis. I only lived there for a few years when I was younger, but people coming back, because obviously my Aliyah process will be different. But I'm wondering with the license and the stage, and for example the Hebrew exam, if you know anything.
I think it's dependent on what stage you're going to be making Aliyah. I came back as not an Ola Khadasha and as Ezrach Ola, which basically means my mum had Israeli citizenship and I was not Israeli at all, and I came back as an Ola Khadasha. Look, it's a different status. I don't think it would make any difference in terms of the residency or the stage or the qualifications. It would probably just mean that you were less likely to need a Hebrew exam. But apart from that, I can't imagine that there's any differences.
Okay, and then just another question. You were talking about the 2-week period where you go and you can just basically shadow a doctor. When is that? Just you show up to a department whenever and you ask to do that? Was there a specific timeline when they happen?
So I would recommend doing it once you have your Israeli license, because once you have your Israeli license, you can turn up and you can request to do it, and they can take you on whenever they have availability. But if you're still in the process of getting the license and you do the histaklut, the 2 weeks, then you don't know to tell them when you'll be able to start, and it makes it a bit more complicated in terms of timing.
Thank you
One
so
thing,
much.
like there's no timelines in Israel. Like there's no specific deadline or timeline. Everyone starts at different times. Like that my GP training program, like they call it like a train. Like people like get on and people go off, and like at the beginning like every single week a new person would join, and then they would have to explain to them like in our teaching session like how it all works. Like from like it's a bit backwards, but it's like it
It's
works. So
really
this is really, it's very informal. There's no like yeah,
Deadlines.
there's no deadlines, there's no start dates. There's like you find someone, you get in, you.
Talia.
Hi, thank you so much for this evening. It's been really amazing. I just wondered, Michal, you mentioned that I could be incorrect, but you went to medical school in Israel after being in England for a few years. And I
Yeah.
just wondered how that was possible and how that worked.
It's a good question, and it's definitely not a regular route. I decided after 3 years of medical school, I got married, and my husband had a place to carry on his degree in the or to do a PhD in the Technion. So I decided to take a gap year. I was at King's College, and I told them I was taking a gap year. And during that period, I decided I was either going to get accepted to continue in Israel, or I would go back after that year. So I wasn't sure before I came here that I was going to get accepted to continue. And in that year, I did Ulpan, I did medical Ulpan, and I, like we've been saying, that in Israel it's a lot more informal. So I would basically turn up at the universities and present them with all of the grades that I'd been given in King's College, and I said to them, "This is what I've done. And do you think that this is something that could?" And I went for interviews at every single Israeli university, and then They asked me to do the SAT, and I did the SAT, and I came back with the results. And in Bar-Ilan, where I did my medical program, they have a 3-year program for Israelis that have studied the first preclinical years abroad. So I joined the Bar-Ilan program as an Israeli and finished my clinical years in Israel. But it's not like a common thing. I'm the exception, not the rule.
I was also gonna get you to explain how you managed to do that.
But I must say, this is the funny thing, that I went through my interview and it was grueling because I was trying my hardest to pull Hebrew sentences together and, trying to impress the interviewer that I could just about speak Hebrew. And at the end of the interview, after I just managed to pull my way through, he was like, "It was lovely to meet you. I'm also a graduate of King's College." And I was like, "Why did we do this in Hebrew?" But that's how it works.
Thank you. Any final questions? Okay. Oh, we're nearly done on an hour. Go us. Thank you so much to both of you for taking the time out and joining us. I have both your contact details if anyone wants to get in touch. I'm gonna assume you're happy for me to pass them along. You're nodding, I think. Yes. Thank you.
Sure. I would just add too, you can join our community and there's much more like contacts as well. You can just scan that and join.
I also have the contacts of a couple of people who finished medical school, didn't do F1 and made Aliyah and went straight into stage. So if anyone wants those, please text me. My number's in the group chat. Or you can email me, and the email is on the link for tonight that you got. And they've also said that they're happy to have their contact details passed on, but they couldn't make it because they are all on their 24-hour shifts currently doing stage. Yeah, I'm gonna stop the recording in case anyone has any dying